Hello everyone, welcome to Bone Doctor. In today's episode, I would like to discuss about one of the diseases which is endemic in our country, that is tuberculosis. Tuberculosis has been endemic in our country since ages. We have recorded tests stating tuberculosis and its symptoms even up to the Vedas. Tuberculosis still rules as one of the most important disease in our country in spite of regular BCG vaccination given to all child who are born in India and in Southeast Asia. Today we are going to discuss about tuberculosis in the bones and the joints, that is the skeletal system. Tuberculosis in the skeletal system most commonly affects the spine, that is the vertebral column. Next is the hip joint, then it affects the knees, then the other joints. So most commonly we find the tuberculosis affecting the spine, causing damage to the spine, deformity and neural symptoms which causes severe disability and problems in the patient. Now, how does tuberculosis affects the bones of the skeletal system? Tuberculosis in the skeletal system is most commonly secondary. That is, tuberculosis first affects other organs of the body, makes entry through the other organs of the body, and from that organ through the blood system the tuberculous bacilli reaches the bones, that is the vertebral column, the hip bones, the tibia, phalanges, foot, etc. So what are the tuberculosis which is the primary or which occurs first prior to the bone tuberculosis? Most commonly it is the lung tuberculosis which is known as pulmonary tuberculosis. From pulmonary tuberculosis the bacteria travels through blood to the bones. Tuberculosis affecting the lymph nodes of the body. Tuberculosis may be present in the mediastinum, that is inside the chest cavity, or tuberculosis may be present in the kidneys or in the prostate. These tuberculosis travel through the bloodstream to affect the bones, causing skeletal tuberculosis. So let us understand what are the symptoms of tuberculosis. How can we understand that a person is suffering or probably suffering from tuberculosis? First is fever. Though in other infections we know that there is a high grade fever, in tuberculosis there is a low grade fever, and that also occurs in the evening, in the late night, and goes off by its own without any medication. This fever regularly comes in the evening. There is a symptom of weight loss, cachexia, that a person suffering from tuberculosis loses weight very fast. The person becomes anorexic, that is, he doesn't have the liking to eat, he loses appetite. Skeletal tuberculosis may present with deformities, that is, if it is in the spine, then the spine may appear curved. If it is in the hip joint, there will be deformity and limping in the hip joint. The pain component is relatively less compared to septic arthritis or in other pyogenic infection, because tuberculosis causes relatively less inflammation compared to other bacteria. There may be presence of cold abscess. Why it is known as cold abscess? Because if there is abscess or pus formation in any part of the body, it is supremely painful. But in case of tuberculosis, there may be an abscess around the spine or abscess in the hip joint, but the pain component is much less than other abscess. That abscess may burst and may puncture out through the skin, causing a constant discharging sinus around the spine or around the hip joint. These are the features of tuberculosis, skeletal tuberculosis in a person. How do we diagnose a tuberculosis? First thing we do is an X-ray. X-ray of that particular joint or a particular bone to see whether there is a tuberculosis or not. In X-rays, we can see symptoms and signs of cold abscess. We may see deformities, there is a fracture of the vertebra, collapse of the vertebra. We may see damage to the joints. If the hip joints are affected, the hip joints are damaged due to tuberculosis. The joint space is reduced and the anatomy of that area is deformed. We do certain blood tests which are marker of tuberculosis. For example, complete blood count and ESR. ESR is almost always high in tuberculosis cases. We do C-reactive proteins to see the presence of any inflammation, that is always high in tuberculosis. In certain cases, we do immunoglobulin tests. We do TB gold test to find out the presence of tubercular antibodies in the blood. Though these tests are non-specific, but it helps us to guide or to make a diagnosis of tuberculosis and to proceed for its treatment. Newer imaging techniques such as CT scan, MRI gives a clearer picture of the soft tissue, of the cold abscess, of the pus formation, or overall damage to the nerves and the ligaments due to the tuberculosis. Early stages of tuberculosis where the bone damage has not occurred can be very early detected by MRI and CT scan. Definitive diagnosis of tuberculosis is obtained by biopsy. A fine needle aspiration cytology from the pus or a biopsy from the damaged tissue gives us a definitive diagnosis of the tuberculosis. Tubercular bacilli is quite commonly not seen in the biopsy or the cultures. Getting a tubercular bacilli in a culture or under a microscope is difficult. But the telltale sign of tuberculosis, that is granulomatous tissue formation, granuloma formation, in biopsy gives us a definite diagnosis of tuberculosis and helps us to diagnose and start the treatment of tuberculosis. What is the treatment of tuberculosis? Treatment of tuberculosis is anti-tubercular drugs. There are many regimes to it. There are many categories to it. Those are not a topic to be discussed in this video. But the most important thing which I want to convey is that these drugs need to be consumed for a long time. In case of pulmonary tuberculosis or in case of non-skeletal tuberculosis, the antitubercular drugs are taken for 6 months. But in bone TB, in skeletal tuberculosis, antitubercular drugs need to be taken for at least 18 to 24 months, that is about 1.5 years to 2 years. Because skeletal tuberculosis is a very resistant type of tuberculosis which needs longer time to heal. So if a person discontinues antitubercular drugs earlier than prescribed, he may have a relapse of tuberculosis and he may have a relapse with a multi-drug resistant tuberculosis, which is a very critical condition and which is a very deadly condition. Because if you have a drug-resistant tubercular bacilli doing a tubercular infection in your body, then no drug can prevent its proliferation and tuberculosis may lead to death of the patient. So tubercular drug, if diagnosed with tuberculosis, tubercular drugs should be taken as prescribed by your physician. If you loved this video, please give a like. If you wanted information to be shared, please share. If you like my channel, please subscribe. And if you want to know around anything about these videos, you may subscribe to my channel. Bye bye for now. Take care.